This is a 2-year-old female that presents with fever and pulling on her right ear, stating that it hurts. She's had a history of 3 to 4 days of a runny nose with yellow-green discharge. She's been fussy the last 4 days, especially at night. Mom is unsure of the aggravating factors, but has noticed that Motrin has helped relieve the pain. The pain has decreased substantially on the drive to the emergency room. She is fussy. There is no eye drainage and no drainage from the ears. Does have a dry cough and a normal appetite. There has been no history of recent swimming. The patient does attend daycare 4 times a week and has missed the past 2 days. Her big brother does have a history of ear infections and has had bilateral ear tubes. Mom is concerned this is the same issue. He has had a cold for about a week. There's been no recent travel and no smoking in the home. Past medical history is non-contributory. Past social history is also non-contributory. For medication, she has had Motrin. The last time she had it was last night at 2100. It was 1.8 milliliters. From family history is non-contributory except for the brother having the ear tubes at 18 months old. With review of systems, the patient is irritable but well appearing, pulls on her right ear, does have a history of Q-tip use, does have the runny nose for the 3 to 4 days with the yellow-green discharge. She does have a dry cough. There is no pain outside of the ear. Has had good PO intake according to mom. In summary, this is a 2-year-old, well-appearing female with history of 102.7 Fahrenheit that's tugging on her right ear, with a history of 3 to 4 days of runny nose with yellow-green discharge, has been increasingly fussy for 4 days, has been worse at night, and history of ill contact of her brother. On physical exam, her right tympanic membrane is not visible. She does have foul purulent drainage coming from that ear. There is no mastoid tenderness, no auricular edema or tenderness. Her left tympanic membrane was pearly gray and visible. There is thin yellow-green discharge noted coming from her nose. She does not have any dental abscesses or exudate. She does have moist mucous membranes. She does have less than 1 centimeter mobile, non-tender, superficial cervical chain nodes that are palpable on the right side. Due to this, her diagnosis is most likely acute otitis media with perforation due to the positive purulent foul discharge in her right ear, the history of the fever, and the pain decreasing while she was coming to the emergency room. The pain probably decreased when the tympanic membrane perforated. It is less likely that it's mastoiditis due to there is no pain, there's no redness or swelling over in the mastoid bone area. It is doubtful that it is acute otitis media with effusion because this is usually not painful and the tympanic membranes are visualized. They just have decreased mobility. In this case, we're not able to visualize her right tympanic membrane. It is also less likely for it to be otitis media externa due to the no history of recent swimming, and then you cannot appreciate erythema in the external canal. She does have a history of Q-tip use, which would make you think that maybe it could be this. However, with her high fever and the purulent discharge, her diagnosis is most likely otitis media with perforation. Thanks.